Hi, welcome back to our channel Jonaki and Mo Paradise. Today we are going to start a very special session, that is Hello Doctor. In this session we will invite all other famous and very reputed doctors in our platform, along with my students as well as the junior doctors will coordinate or co-hosting the entire program. Hope this kind of session will clarify your all kind of medical related doubts and queries as much as possible. Today is 1st July. In all across India, this day is celebrating as National Doctor Day to honor the reputed physician as well as the second Chief Minister of West Bengal, Dr. Bidhan Chandra Roy. He was born in 1882 on 1st July and he died on the same date in 1962. In this special day, we have invited a very famous and reputed doctor, Dr. Prasenjit Chatterjee. He is senior clinical oncologist. To coordinate the entire program well, we also invited my student as well as my junior doctor, Dr. Tanvi Singh and Dr. Shubhendu Mitra. Before starting this session, I request to Dr. Tanvi Singh and Dr. Shubhendu Mitra to introduce yourself to all other audience.
Namaste. Myself Dr. Tanvi Singh, working as an intern doctor at Howrah District Hospital.
Namaste. Myself Dr. Shubhendu Mitra, intern doctor at BS RGMAC, Techno India.
Now I am telling a very brief introduction regarding Dr. Chatterjee. Dr. Chatterjee, after finishing his MBBS from Burdwan Medical College and Hospital, then he proceeded for MD in Radiation Oncology from Tata Memorial Hospital, Mumbai. Afterwards, he served several hospitals as senior oncologist and then he returned back to Kolkata. Now, presently, he is attached with the Army Hospital, then Apollo Clinicals, Woodland Nursing Home and all. Now I am requesting Dr. Tanvi and Dr. Shubhendu for hosting this program likewise.
Sir, nowadays we are getting so many emails, messages from our social media page, Facebook page. Maximum people are asking, are all the patients of cancer at risk to have COVID-19?
Hello, thank you. Feeling good. And organizers, Team Priyanka, good to meet you once again. So the question what you said is about the risk for people with cancer, COVID. Yes, all cancer patients undergoing treatment often have a weakened immune system. So people with weakened immune system are certainly more prone to other diseases like flu, pneumonia, or maybe common cold, and hence they are more chance of getting COVID infection. That is why people with cancer are classified as the most at risk for having subjected to severe restrictions.
Sir, I was having a question that should all the cancer patient cocoon at home or healthcare facility during this pandemic?
Yes, very interesting question. Should patients with cancer cocoon at home, right? From healthcare facility. Yes, I believe that all cancer must cocoon, including patients who are taking chemotherapy, patients who are taking radiotherapy, especially one who is taking radiotherapy to the lung, that is most important. And patients with blood and bone marrow cancer, they are more prone to COVID infections. People having immunotherapy and other targeted therapies, they are the ones who should be more careful. People with bone marrow stem cell transplants, the immunity is at the lowest brim, so they should be advised to take adequate precautions. Certainly that is most important for them.
Well, is there any variation in risk for those with cancer?
Oh, that's a very interesting question. Variation so far as risk is concerned amongst all cancers, right? For COVID infection, certainly there is, because according to WHO, World Health Organization, risk may be higher for those with blood cancers. Yes, leukemia, that is the one who undergoes transplant treatment. They should be more careful of catching COVID infection, so adequate precaution again and again has to be taken for this strata of cancer patients with mandatory restrictions.
Sir, I have another question. That is, how should be the cancer care and treatment approach during the corona pandemic?
So your question poses like this, that which cancer patients has the priority, right, for treatment during this unprecedented pandemic? Yeah, that's a very interesting question, I believe. Now, post-surgery chemotherapy with curative intent, they should be prioritized to the maximum level. They should proceed with the treatment without further delay. And risk for treatment delay for patients with metastatic disease, yes, that can be considered to some extent, making decision so far as delaying the chemo or holding the chemotherapy depending upon the priority in a metastatic setting. That is very important. And delaying surgery in a select group of patients is also important, like in a very early breast cancer. If she is a hormone positive, then we can subject these patients to hormone treatment and delay the surgery, because surgery needs admission, increased chance of COVID infection. So this group of patients should be given a priority, how we can delay the treatment. That's interesting.
So, can you please explain the importance of preventive cancer screening like mammogram during this pandemic?
So you want to ask like preventive cancer screening tests, and what are the guidelines in this pandemic? Yes, I would say that all patients should avoid visiting the hospital as much as possible in this middle of the unprecedented pandemic, certainly. Now, for the screening, we know due for screening mammogram and other screening, please postpone. Whenever a patient on a teleconsultation or telemedicine or maybe visiting in your office or clinic asks for a screening, try to delay or postpone because it is not an emergency situation. Now, if a patient certainly has symptoms, then he or she should contact the healthcare provider, the cancer doctor, and according to the symptoms, we do the relevant test. Like instead of doing a mammogram in the breast, we can do an ultrasound of the breast. Patients or infrastructure having the probe for TVS, transvaginal ultrasound, can be done in patients who are suspected to having a bleeding PV or bleeding per vagina to rule out any tumor in the uterus or in the cervix. So that is the way forward. In a given setting, you can do a PSA type of blood test, which is a tumor marker in an elderly male population who is having symptoms of incontinence, inability to control the frequency of urine, and of course nighttime passing urine most of the time in again elderly population.
Now, sir, I'm also asking some question. So I'm having two questions back to back. First question is the patient who is already having cancer. So the cancer or the CA patient who is feeling or thinking that might be he is having such of the symptoms or like COVID-19 and all. So in that cases, what would be the actual steps or what kind of steps should be taken by this kind of CA patient and all?
So your question is like, who is at a greater risk amongst all cancer patients for COVID-19, right? So having said that, I would like to say that every cancer patient is at risk of having COVID-19 contraction. Now, patients on standard chemo regime, mostly solid tumors, have transient immunosuppression, right? The WBC count gets depressed and that can be managed conservatively. But patients who are on blood cancer having high dose chemotherapy, patients on transplant, they are the ones who are at maximum risk. So adequate prevention, precautionary measures has to be taken in a discreet manner for this group of patients.
Same like I'm having the next question, that is usually the cancer patient who are very much susceptible towards this kind of COVID-19 and all. So actually what kind of precaution they should take to prevent these situations or this kind of pandemic and all?
If I get your question right, patients, what are the precautions to be taken for solid tumors who are susceptible to COVID-19? Now, the pressure at the hospital has to be reduced to the minimum, especially hospital with cancer care facility. The volume of patients should be reduced, the triage facility should be implemented and executed before a patient gets entry into the hospital. Now, management of patients with cancer at home, that is by telemedicine or phone call, should replace hospital visits as much as possible. And sometimes replacement of the intravenous drugs which patients need hospital admission can or should be rather replaced with oral hormonal therapy or maybe targeted oral therapy for a better compliance, reduced chance of infection. That has to be taken care. The infrastructure, the logistics should have the facility like reducing or rather giving intravenous chemotherapy at daycare centers or centers having outpatient department or daycare services in an open air department where chance of contraction in a closed air conditioned environment is higher. That should be also taken care. There's adjustment of dose schedules in chemotherapy. That also has to be taken adequate care. Spacing of the chemotherapy, the total duration of the radiotherapy treatment, the newer guidelines.
So one question is there which is arising in the mind of every patient. In fact, we are getting the questions on the social media and all that what should a cancer patient do if they think they are having COVID symptoms? So sir, can you please explain this point?
Oh, that's a good question. So you want to ask patients who are suspected to have COVID-19 or who are actually cancer patients, what they should do. They should avoid visiting the hospital, very importantly, because that increases the risk of dissemination of COVID amongst other the cancer patients, the paramedical staff. So you should call the hospital, call the doctor, do a teleconsultation, try to do a RT-PCR test at the home level, because now there is a facility for doing RT-PCR at home, and wait for the reports. You have a COVID-19 helpline numbers. You can always ask for what should be the guidelines, where should he or she visit, the nearest centers if required, an admission, and what should be the protocol so as further dissemination is curtailed to the maximum. So these are the small things which needs to be addressed, and routinely guideline has to be there in all cancer center facilities, whichever is possible.
Now, in recent, we have seen that they are having different myths. One day, some doctors are telling that these medicines is working good in case of COVID-19. The next day, as per WHO, some other notification is coming, and not only that, entirely the advice, on behalf of doctors, continuously changing day by day. So what happened? The common people, they are actually becoming very much confused. So that's why there are different myths already originated regarding this COVID-19 and all. So that's why one myth I know, that I'm asking you, sir. Now regarding this myth, the question is usually this hand dryer, UV rays, the thermal scanning and all. So actually, what are the actual role of those procedures? Really, are they avoiding any kind of or preventing any kind of COVID-19 invasions and all?
So we are talking about some COVID-19 and myths, yes? As you said, the dryers, hair dryers. Yes, there is a myth of using hair dryers. It says it can reduce contraction of COVID, but that is certainly a myth. Hair dryers never reduce COVID-19 transmission. Even the ultraviolet rays, in fact, it can cause skin irritation. There is no evidence to suggest that ultraviolet radiation can immune you from COVID-19 contraction. Even the thermal scanners, the one you have put up, is very important to detect fever. So all facilities, offices and structures should have a thermal scanner, but it can only detect fever. That doesn't help in detecting infection. So that is absolutely a different criteria. A patient can have an infection 2 to 4 days back and he or she may not have a fever or may have a fever. So that are two distinguished levels which should have a knowledge for general community at large to understand that.
No, another myth I'm asking, that they are having several animal lovers. So they are having so many pets in their home, like cow, dogs, rabbits. Especially in villages, they are having cows, and in city they are having dogs, rabbits, cats, etc. So now the question is, can those animals spread this virus, or like that coronavirus, to the human body?
Oh yes, there are a lot of guidelines and studies which has been done about pets at home. Till date, there is no study which suggests that pets can transmit diseases. But of course, it is important to use antimicrobials after handling a pet, maybe a dog or a cat, to prevent other infections like salmonella. But there is no evidence that there is COVID-19 transmission through the pets or domesticated dogs and cats. So there should not be a second question on that.
So another thing is, all time we are getting notification that the old people, okay, and sometimes the newborn babies, not only newborn, even younger people, those people are also getting, they are also becoming very much susceptible towards COVID-19. So that's my question. So really, the aged people and the younger people and the infants, all are susceptible towards COVID-19?
Of course, the other things between the age, old age and the young age, susceptibility to COVID-19, of course not. One thing should be very careful, that is, old age usually have other comorbidities like diabetes, hypertension, or maybe other heart diseases. So that is an comorbidity which has a chance of having a severe infection. That can lead to an admission to the hospital, maybe an ICU stay. But otherwise, old age per se or young age they don't have increased risk of COVID-19 transmission, that is for sure. And we have this new COVID-19 Delta variant, which there has been extensive study, with there is already cases which has been discovered in India, almost 25 cases till date, and it has been seen that it can be a fatal disease in the pediatric population because there is not adequate vaccination done in that age group. So we need more studies, and that has to be validated to understand what should be the impact of COVID-19 maybe in the third wave.
Sir, now I'm having the last but not the least question. That is, usually the antibiotics, people are telling if you are having the antibiotics in the proper time, then definitely it will prevent the COVID-19 massacre like that. So that's I'm asking, really antibiotic can prevent or can treat the COVID-19 as well?
See, till date we don't have any antibiotics, any special medicine for treatment of COVID-19. The antibiotics can prevent a secondary infection for sure, but no antibiotics has got immune properties to have a virucidal effect, killing. There are some cocktails which are available, the combination of monoclonal antibodies, which is little expensive, available. They can prevent a severe infection if given in a period of time like day 3 or day 4 of a moderate infection. But we don't have anything other than vaccine and double masking. So till date, my take home message for you friends is mask up, and please try to ensure that you have a double mask where you are in a susceptible or in a micro containment or a macro containment zone, especially when you are visiting a hospital. But mask cannot be put down. And secondly, vaccine. That should be the way forward till we have further evidence on anything else. Thank you. I'll be happy to answer your questions.
Thank you so much, sir, for your very informative and beautiful session. I hope all the common people will be benefited by your several answers.
Thanks a lot, Dr. Chatterjee sir, for answering the question and for the great information. It was a pleasure to have you with us. Thank you so much. And I would like to thank Dr. Priyanka ma'am for organizing this beautiful session. We have learned a lot of things, and I am definitely sure that many people are benefited from this session. Thank you all.
Thank you, sir. Thank you, ma'am, for the very informative session arranged for us. It was a really very good and very informative session. Thank you, sir, for sharing your very valuable knowledge with us. And thank you, ma'am, for arranging this kind of session. We are waiting for the more and more sessions of this kind to come up with. Thank you, ma'am.
And also I'm giving thanks to Dr. Tanvi Singh and Dr. Subhendu Mitra to collaborate this entire session very nicely. And you, the audience, my request that if you like our session and really it is very much informative for you people, then definitely we will continue this kind of Hello Doctor session afterwards also. So please like our channel, please share and kindly subscribe. Again, we'll be coming next time with some other doctor in this platform. Now time to say bye-bye.